Hello, I'm Ben Coley. Much has been made of the debate between traditional Medicare supplements and the new Medicare Advantage program. There are many facts to consider when choosing between a traditional Medicare supplement and a Medicare Advantage plan. While there are very many similarities between the two, there are also very many differences. Today we're going to discuss the facts that you should consider when choosing between a Medicare supplement and a Medicare Advantage plan. We'll begin with Medicare supplement. Medicare supplements offer supplemental coverage which allows you to keep the flexibility of Medicare but helps limit the out-of-pocket expenses. In other words, under a traditional Medicare supplement, Medicare is the primary payer while the Medicare supplement is secondary coverage. Medicare supplements are provided by private insurance companies. They are often called Medigap policies because they cover the gaps left by Medicare. Medicare supplements have been standardized with 12 plans, A through L. Anyone who is eligible for Medicare may apply for any Medicare supplement at any time. However, there are certain situations that trigger open enrollments which do not require medical underwriting. Those situations are when a beneficiary is first eligible for Medicare, when a beneficiary has lost their retiree coverage or current employer coverage, or has had their Medicare Advantage plan cancel their coverage. Almost every doctor accepts Medicare supplement. Any doctor that accepts Medicare must in turn accept Medicare supplement as insurance. All Medicare supplement plans are required to have the core benefits. The core benefits are as follows. Approved hospital costs for the co-payments for days 61 through 90 in any Medicare benefit period. Approved hospital costs for the co-payments for lifetime reserve days 91 through 150. Approved hospital costs for an additional 365 days after all Medicare benefits are used. Charges for first 3 pints of blood and Part B coinsurance. Medicare supplement plans A through L offer a mix of the following benefits on top of the core benefits, such as skilled nursing coinsurance, hospital deductible, doctor deductible, Part B excess charges, foreign travel emergencies, at-home recovery, basic drug benefits, and preventative care. To see the exact benefits for each Medicare supplement plan A through L, please refer to your Medicare handbook or the following website. The two most popular plans are Plan F and Plan J. With Plan F and Plan J, the biggest benefits are the hospital deductible, the Part B deductible, and the Part B excess charges. With those benefits, it is very rare that a beneficiary ever receives a bill of any form for their care. Most people have moved from the Plan J to the Plan F since the implementation of the Medicare Part D prescription drug program. Premiums for Medicare supplements vary on issue age, attained age, gender, and smoking status, if applied for after the 6-month open enrollment period. Each state's Department of Insurance has a website with a link that compares every licensed company's premium rates in that particular state. The main difference between providers is cost and customer service. Keep in mind, every insurance company that offers a Medicare supplement under the standardized plans, the benefits are exactly the same. Let's move on to Medicare Advantage. The Medicare Modernization Act of 2003 changed the name of Part C from Medicare Plus Choice to Medicare Advantage. It is offered by health maintenance organizations, preferred provider organizations, and private fee-for-service organizations. They are sold and provided by private insurance companies. Although Medicare is no longer the primary payer under Medicare Advantage, beneficiaries are still responsible for their Part B premium. Medicare Advantage takes the place of original Medicare and is required by CMS, the Center for Medicare and Medicaid Services, to be as good or better than regular Medicare. Providers are required to have multiple plan options in the service area. In other words, in order to take a Medicare Advantage plan, there have to be multiple options for you to choose from in your service area. Medicare Advantage plans may or may not include prescription drug coverage. If Part D is included, beneficiaries are locked into the company's specific Part D plan. Premiums may or may not be included for the Medicare Advantage plan, the Part D plan, or both. Unlike Medicare supplements, Medicare Advantage plans are not guaranteed renewable. Within the first 12 months of being on a Medicare Advantage plan, the beneficiary is allowed to return to the Medicare supplement they had prior, or if they elected the Medicare Advantage plan when first eligible for Medicare, they are allowed to go back to any Medicare supplement without medical underwriting. Medicare Advantage plans offer additional services not covered by Medicare or Medicare supplements. No claim forms are required. There are set fees for most in- and out-of-network medical services. There are annual out-of-pocket maximums, and there are 2 enrollment periods for Medicare Advantage. Medicare Advantage concerns. Medicare Advantage generally will have extra costs, restrictions, and rules to their plans that are not incurred by traditional Medicare supplement. For example, they will limit you to a specific doctor and hospital network. They may be more expensive than original Medicare for some types of health care. They can require specific permission for services. Premiums, copayments, and benefits can change from one year to the next. They may also be terminated, which requires you to find a new plan the next year. Doctors and hospitals have the ability to leave Medicare Advantage plans at any time of the year, while you can only leave at specific points during the year. Medigap policies cannot be purchased to cover additional expenses, so you are not allowed to have a Medicare supplement plan and a Medicare Advantage plan. Medicare Advantage plans rely solely on the funding through Medicare to provide benefits and services to their beneficiaries. The biggest concern with the funding through Medicare is that it is set to be cut by nearly $2 billion in 2014. A diagram of how Medicare Advantage plans offer their services. The funding is through Medicare, and the Medicare Advantage plan now takes over all the benefits and services provided to their beneficiaries. That concludes our comparison of Medicare supplements and Medicare Advantage. For any questions, contact us as follows.